Hi everybody, welcome to a new episode of the Dissenter. I'm your host, Ricardo Lopes, and joining me today is Dr. David Gorski. He is a surgical oncologist at the Barbara Ann Karmanos Cancer Institute, specializing in breast cancer surgery, where he also serves as the medical director of the Alexander J. Walt Comprehensive Breast Center. He is also professor of surgery and oncology at the Wayne State University School of Medicine and faculty of the graduate program in cancer biology, and is also the managing editor of Science-Based Medicine. Dr. Gorski, thank you a lot for taking the time to come on the show.
Oh, thanks for inviting me.
Okay, it's my pleasure. Okay, so I would like to start off with by asking you to please tell us a little bit of the history behind the creation of science-based medicine. Who had the idea of creating it and why?
Okay, excuse me. It was Stephen Novella, as you may have known, was the creator. Basically, back in late 2007. I got an email from Steve asking me if I wanted to be part of this, collective that he was putting together. Harriet Hall was one of the original members. Kimball Atwood, who's no longer writing for it. Really, the only original members we have left are me, Harriet, and Steve. But over the years, we've had different bloggers come on. We try to keep something, at least one post a day during the week if we can. In any case, yes, he asked me if I wanted to join, and I did. And eventually, it's sort of because Steve is so busy running his multimedia empire, being the actual editor kind of fell down to me. Now, being editor is not that huge a deal because everyone's so good and there's not much editing to do, but it does become an issue when it comes to evaluating, guest posts and trying to, because people do submit their work and a lot of it's not very good. Some of it's good and trying to, trying to get the difference, trying to weed out the good stuff is.
Yeah, sure. But could you tell us perhaps what was the original motivation behind it?
Well, okay, first you have to go back 10 years because it was a different world on social media back then. Facebook was in its infancy. It had only just been open to everybody for maybe a year and a half, and I didn't even have a Facebook account back then. Twitter didn't exist yet. All these other social media, platforms didn't exist yet. So blogs were kind of it as far as, and Usenet. Do you remember Usenet?
Yes.
Do you even know? Okay, I was going to say, people your age may or may not remember what the heck, or even know what Usenet is. So, but Usenet was dying. It was actually, ironically, it was dying of the same sort of thing that's hurting Twitter now. It was trolls and, obnoxious people, and personal attacks and all sorts of nastiness was drowning. It was all drowning out the actual conversation. But in any event, it became obvious, I think, to Steve and to us that there was a lot of pseudoscience and misinformation out there about medicine. Even more disturbingly, some of that pseudoscience was actually in medical academia. And back then it was called complementary and alternative medicine. These days they prefer to call it integrative medicine. So Steve wanted to have a platform for discussing and refuting that, but we don't limit ourselves to that. We'd also discuss, just the science of medicine in general. Our focus tends to be on the pseudoscience, mainly because at the time there weren't that many blogs or other people doing that, and over the years we've become pretty well known. So we're not infrequently contacted by reporters, and our traffic is is quite respectable now. So,
Yeah, sure. Okay, but would you say that back then, like 10 or 11 years ago, maybe,
mhm.
that complementary and alternative medicine already had a good or important influence in the medical field?
Oh, it definitely did by then. This began, the rise of CAM really dates back probably to the 60s and the 70s, although it didn't really start to take off until around the 1990s with the creation of the National Center for Complementary and Alternative Medicine. Now, it wasn't called that back. The little history here. In 1992, Senator Tom Harkin of Iowa, using his power as a senator, managed to set aside like a couple $1 million for something in the NIH that they called the Office of Alternative Medicine. The idea was to study, alternative medicine, unconventional medicine, whatever you want to call it. It was not asked for. Like, nobody in the NIH was lobbying for this. Nobody in the NIH wanted it. He hired, and I'm blanking on the doctor's name, but he hired someone initially, or the first person to run the office was actually pretty sympathetic to the idea of studying CAM. And even so, they immediately ran into conflict with what they used to call the Harkinites, which were basically, when this office was set up, there was an advisory panel created. And the advisory panel, although it did have real scientists on it, it was also stacked with alternative medicine practitioners and advocates too. And this has been a tension from the very beginning, that anyone who's science-based immediately runs into this advisory council who are not. In any event, later in the 90s, the NIH director tried to bring the Office of Alternative Medicine under more scientific control. The structure of the NIH is kind of weird. There can be these offices and little fiefdoms that the director doesn't have a lot of control over. And so, in response, Tom Harkin introduced and managed to get passed a bill that turned the Office of Alternative Medicine into NCAM, the National Center for Complementary and Alternative Medicine. As a center, it was really not very much under the NIH director's control anymore, at least to the point that to the point that it had been before. And with that came a huge budget increase. And since then, so this entity has existed roughly 26 years now. I think in 1992. So it in the 26 years of its existence, it's gone from a budget of like $1 million to now its budget is around $140 million a year. So it's and 3 or 4 years ago, they decided to go with the rebranding of CAM that's been going on, Integrative Medicine, and they renamed it to the National Center for Complementary and Integrative Health, NCCIH. I like DENCAM better just because it was so much easier to say. It was a much pithier acronym, a much pithier abbreviation, but, whatever.
Yes, okay. And would you say that in comparison with what it was 10 years ago, that alternative medicine nowadays is more or less prominent? Would you say that, for example, it has a stronger legal and academic status than it had 10 years ago?
Sad to say, if I had to pick, I'd like to say it was less. At the very least, it's no less of a force than it was, and it probably is more so. And you can see it in the number of academic medical centers that now have integrative medicine, programs, divisions, et cetera. You can see it in things like like 2 years ago, the Samueli family, gave a $200 million gift to the University of California at Irvine to set up basically this big integrative health center for both clinical and research. And along with, there were several lines for endowed chairs, and it's like, and there are, of course, organizations that lobby for this. If you look at my bailiwick, which is, I'm at you may or may not be familiar with this, but in the U.S., there are certain cancer centers that are, they are given the stamp of approval of the National Cancer Institute, which is a branch of the NIH. They're called NCI Designated Comprehensive Cancer Centers. And there are, I forget what, last count in the mid-40s, something like 40-something of them. And where I work is one. If you look at these, you'll find that a lot of them are starting to adopt integrative medicine programs or integrative medicine, especially into palliative care, which really drives me crazy. I'm fortunate in that my cancer center is not so much one of them. I won't say we don't have any, but compared to, say, Dana-Farber, which is affiliated with Harvard, or Memorial Sloan Kettering, or MD Anderson, the integrative medicine footprint at our place is quite small. But, I'm always on the lookout for someone trying to slip more in. It's like, because I'm sure someday it's coming. It's like, seems to be going on every place else.
Mm-hmm. Yes. And do you have any idea if at a worldwide stage, at a worldwide level, if complementary and alternative medicine has been spreading and gaining terrain over the years or not?
I'm less familiar with elsewhere.
Mm-hmm.
I do know a little bit about Europe. What's kind of interesting is it depends on where you ask. For instance, you might know that in England, the Good Thinking Society has had some really good success in getting the National Health Service to stop funding homeopathy.
Mm-hmm. Yes.
But that doesn't mean integrative medicine isn't still pretty big in England and in the UK. Integrative medicine, these sorts of things, it's really big in Germany. I know that. I know homeopathy is really big in France. I wrote about that last year, or sometime in the last several months. I don't remember exactly when. I have no idea of Spain and Portugal, what the situation is there. You might be able to educate me. And then looking at Asia, it's big business in China. Like traditional Chinese medicine is big business in China, and in fact, over the last couple of years, the Chinese government has even, passed laws and policies designed to promote traditional Chinese medicine. For instance, any hospital in China now has to have a traditional Chinese medicine program. They prop up the industry selling, traditional Chinese medicines, herbal supplements, etc. They're trying to market them to the rest of the world. That's a big deal because China is an economic powerhouse and has a lot of influence. So it's...
Yes, I understand. And okay, so we've been talking about medicine and alternative medicine, but I think that one question that would allow for people to better understand the science and the theoretical foundations behind all of this is, why did you decide, and perhaps this was a decision made by Dr. Novella, I don't know, but why did you decide to name the online publication Science-Based Medicine? Because I'm asking you this because from someone from outside these fields of science, it would seem a bit weird that not all medicine is based on science, right?
Well, it's actually a reaction to something called evidence-based medicine, which there was the rise of evidence-based medicine back in the 90s, which, you might, as an outsider, might think, what the hell, man? You mean medicine isn't based on evidence? Isn't it kind of assumed that that's the case? And yes, it is, but, if you know what I mean. Basically, evidence-based medicine sought to formalize the evidence base of medicine. Before evidence-based medicine, yes, medicine was based on evidence, but there was a lot of room for interpretation, individual clinician interpretation of the evidence, which might or might not be, might or might not jive with what the evidence really said. So the idea was, there was a hierarchy of evidence created, and starting out with like expert opinion and like basic science, small clinical trials, large randomized clinical trials, and then meta-analysis and systematic reviews. Okay, sounds good, right?
Yeah.
Here's the problem. There's a blind spot there. The assumption, although it's an unspoken assumption, behind evidence-based medicine is that to get to the point of doing a large randomized clinical trial, you have to have something that has a lot of evidence behind it, like preclinical evidence, either cell culture animals, etc., or some early promising preliminary human trials that justify doing a randomized. Randomized trials are expensive. They also have human subjects, which means that you could be subjecting human beings to risk. So you really need a good evidence base to justify that. That's the unspoken. That's the unspoken assumption. The idea is, bench to bedside to bench to bedside. I don't know if you've ever seen that circle. Either bedside observations lead to bench research, which leads back to the bedside, or bench research leads to trials in humans. So now here's where CAM slipped in. So advocates started doing clinical trials of highly improbable treatments, like these CAM treatments, using the rationale not that there's a lot of evidence for them, because there wasn't. And in fact, if you look at homeopathy, as I like to say, I call it, is basically magic, is the idea of it's sympathetic magic. I've discussed this in detail, but the idea is, that the water somehow magically takes the essence of whatever you've had in it, that if you shake it, dilute it, shake it, dilute it, shake it, dilute it, even if you dilute it to the point where there are no molecules of the original substance left, there's still somehow that essence, and that essence, you get the idea. But I mean, and a lot of CAM is like that. Not all of it, but I can get into that later, but a lot is like that. And so they start doing clinical trials. And of course, what lay people tend not to realize about clinical trials is that they're kind of messy. It's human beings. There's a lot of variability. There's a lot of possibilities for bias to creep in without your even realizing it. They're hard to do. And there will always be, and also the fact that you set the p-value at 0.05 means that even in an ideal world, like an ideally done clinical trial, an ideal world, roughly 5% of your trials will be false positives. It's actually higher than that, because the clinical trial process is not perfect. If you look at John Ioannidis' work, it could be as high as 1 in 3. So if you do clinical trials on highly improbable treatments, you will get false positives, and you might get a lot of them, and we have a lot of them, and that's why you have to look at the preponderance of evidence and take into account the biological plausibility of the treatment that you're testing. Homeopathy, I like to use homeopathy as an example, because homeopathy is about as close to impossible of a treatment that I can think of, just on strictly physics, on a physical basis, physics and chemistry and biology. Water doesn't have a memory that lasts more than femtoseconds or whatever. It's like so short. There's no physical mechanism by which you can by which we could explain some substance somehow, imbuing the water with these magical properties. And, if you ever, no one's ever really been able to show that a homeopathic remedy is any different than water, at least the ones that are highly diluted. And the ones that aren't highly diluted, well, they have substance left in them, but it's still at a very low concentration. So you say homeopathy, so let's say, you have a homeopathy whose prior probability of working is about as close to zero as you can imagine. Just to be intellectually honest, I say, okay, maybe it's not exactly zero, but it's really, really close, because for homeopathy to work, huge swaths of our knowledge of physics and chemistry would have to be not just wrong, but spectacularly wrong. So you get some you get a few equivocal clinical trials that seem to indicate that homeopathy works for subjective outcomes. And then you have this massive physical evidence that says homeopathy can't work. What are you going to conclude? Homeopathy doesn't work. But in the world of CAM, well, here's the problem. In the world of evidence-based medicine, only the clinical trial matters. Prior probability, they don't even, when you start bringing up prior probability, they will accuse you of bias or of trying to tilt the scale, and sure, that could happen. I mean, you could say, sure, that could happen, but we're talking about clear-cut cases. We're not talking about even slightly borderline cases. Homeopathy physically can't work. Energy medicine, no one's ever shown that there's like this mystical energy field around people that, that healers can manipulate for healing intent. And I could go on. Acupuncture, no one's ever shown that meridians exist. No one's ever shown that putting needles in changes any sort of flow of chi or whatever. They all come up with hand-waving physiologic explanations for why acupuncture might work without actually showing that it does. But in the world of evidence-based medicine, basic science considerations mean almost nothing. They're at the lowest rung of the evidence pyramid. They're at the bottom, or very close to the bottom.
Mm-hmm. Yes.
Now
that we are talking here about names and nomenclature, perhaps we should also address complementary and alternative medicine in terms of the way it is presented. Because, for common people, when they have to solve a issue or a problem, and someone tells them that what they have to offer them is an alternative, then people who don't understand really what they're talking about would perhaps interpret it as being something that works at least as well as the other thing, right? The other possibility. So that might induce some error in people, right?
I like to look at it. Well, the naming of this phenomenon has been very deliberate. The branding. 30 years ago, it's alternative medicine. 30, 40 years ago, it's alternative medicine. That's what they called it. And even before that, it was more like quackery or, but alternative medicine, from the 70s to the early 90s. But practitioners and advocates realized, well, there's a problem with that, because if you use it, if you don't know for sure, if you can't say that you use it, you're going to use it as an alternative to medicine. That people are smart enough to realize that probably isn't a good idea. At least most people are. So that's where the term complementary came in. They say, okay, use medicine, use science-based medicine, but you can use this as a complement. This is complementary. That's how they got a lot of physicians in, because they say, okay, what's the harm? And, in some cases you could see maybe there's not much harm, but other than financial, for paying for something that doesn't work. But complementary wasn't enough. And here's where what does complementary imply? the word complementary. It implies that it's, in addition to, that it's like the icing on the cake, that it's not as good as, that it's, not necessary, right? Complementary. It complements. It's a nice, like, that it's a nice thing to have, but you don't need it, right? Mm-hmm. So that's where the evolution of the term integrative started to come in. Now integrative has a different connotation. The idea is that you're integrating this, whatever you want to call it, alternative medicine or whatever. You're integrating it with scientific medicine, evidence-based medicine, whatever you want to call that. Integration implies more of an equal footing. So and you will not infrequently hear advocates refer to it as integrating the best of both worlds, whatever that means. So, the brand, and it's also been, there's another rebranding that's occurred. They don't really call it medicine anymore, as much as they used to. Yes, they still call it integrative medicine, but a lot of these departments and programs are changing their names to some variation of integrative health, or integrative health and wellness. And wellness is a term that drives me crazy, but so the rebranding, I think, has been very intentional. The idea now is that this is this is probably at least on semi-equal or roughly equal footing with medicine, or it's not so far below scientific medicine that you should poo-poo it, that it's beneficial enough that you could say it's necessary and that it should be integrated. The other thing that goes along with this is a rebranding of a lot of treatments or interventions that are actually evidence and or science-based. For instance, when did exercise become integrative? Right? But yeah. They claim integrative medicine claims exercise as and any lifestyle intervention pretty much as its own. A false dichotomy is proclaimed basically that we do the lifestyle and natural stuff. Medicine is all surgery and drugs. So or diet. When did nutrition and diet become integrative? It's right. And for instance, I like to give this example because they'll say, okay, medicine doesn't care about this stuff. I point them to the American Diabetic Association guidelines for newly diagnosed type 2 diabetes. And and I say, okay, what's the first recommendation there? Is it metformin? No. It's lose weight, exercise, low carb diet. And then if that doesn't work, to bring the elevated glucose, to achieve glucose control, then you kick the drugs in. Similar with hypertension. Like so many middle-aged guys, I have hypertension, and when I was first diagnosed, did they hand me a prescription? Did the doctor hand me a prescription my first visit where the blood pressure was high? They're like, okay, try to lose some weight, try to exercise. We'll see if it comes, if you get your blood pressure down. It didn't work because, I have a family history problem. First, I'm too lazy and I didn't do as much as I probably should have. But I don't think that would have worked anyway because I have a pretty strong family history of hypertension in my family. So, and I'm currently, my blood pressure is quite well controlled. At the moment, so it's.
Yes. Okay. So the next question I would like to ask you is perhaps, okay, is there any alternative, or let's say, is there any pseudo-scientific medicine of this sort that you know about that you would tell a patient that it would be worth trying, even if only in limited circumstances?
Can't really think of any. I mean, I guess the only thing, I guess it depends. Cause, okay, so I hate to sound like I'm waffling, but it depends. What are we talking about? What modality? If I accept the rebranding of some modalities as integrative and alternative, then like, exercise, diet, yoga, fine. There's unless you have a physical condition where you could hurt yourself doing yoga, I don't think I don't think there's any harm in it, right? It's like the only thing I object to about yoga is the all the mystical overlay that comes on it. But if it's just yoga, it's basically a form of exercise. Exercise discipline. I always say, for instance, I don't have an objection to massage, but it depends what the claim is. Massage patient. People like a good massage. It feels good if it makes the patient feel better, maybe more able to deal with his or her illness. Who am I to say don't get a massage? The problem comes when there are specific therapeutic claims made for the massage. Then I start to get, the skeptical antennae start twitching.
Yeah, okay, I understand. And would you say that there are some specific cases where the application of complementary and alternative medicine, is the most dangerous? So, for example, I don't know, perhaps the anti-vaxxer movement, because
well, that is an issue. Certainly, a lot of alternative medicine is infused with anti-vaccine views. The idea is, for instance, basically, it's the body more than the microbe. In other words, if your body is healthy and your immune system is healthy, you can fight off these microbes. You don't need vaccines, right? That's kind of the idea that you'll find in a lot of these anti-vaccine arguments and discussions. I like to point out that in the flu pandemic of 1918, lots and lots of perfectly healthy 18-year-old soldiers died of the flu. Presumably, these are strapping young men from the Midwest, who were farmers or, who did physical labor before they became soldiers for World War I. So, the point is, a lot of these diseases can kill you even if you're perfectly healthy. So, that's a bad argument. But for instance, naturopathy, lots of anti-vaccine ideas there, right? Chiropractic, lots of anti-vaccine ideas. And that's sort of one of the things that infuriates me about a lot of these academic, supposedly respectable, scientific-minded doctors in integrative medicine programs in academic, universities, is that they seem to be kind of blind to what the reality is on the ground with these treatments. They're up there in their little ivory towers, and they're saying, what's the harm in this? And of course, we're not anti-vaccine. We strongly support vaccines, right? And they can't imagine how anyone wouldn't, which is fine. Before I had my own encounters with the anti-vaccine movement those many years ago, I kind of thought the same way. Like, how could anyone be anti-vaccine, But, they don't understand the reality of what actually is being sold. And in particular with naturopathy, it just drives me crazy that there are naturopaths on the faculty in some medical schools, including my alma mater. There's at least one naturopath on the faculty of my alma mater, the University of Michigan Medical School. And of course, some of these naturopaths who make it into the academic career also deny that naturopathy is anti-vaccine. The evidence says otherwise. But anti-vaccine is not just the problem. Cancer is a problem. Cancer is a problem. You may be aware of the recent couple of studies that show, first that alternative medicine use in cancer is associated with a much higher mortality rate. Mm-hmm. And then the more recent one, which was just like a month or two ago, that shows that CAM use is also associated with a higher mortality rate. And part of the reason may be because there's another study that suggests a reason. From a year or two ago, it showed that CAM use was associated with a higher chemotherapy refusal rate, for instance. So, for a lot of cancers, surgery might be the primary treatment. But you get chemotherapy afterward to decrease the chance of the cancer coming back. This happens. This is a lot of breast cancer patients get chemotherapy for that reason. A lot of colon, rectal cancer patients get chemotherapy for that reason. It's not the curative treatment, but it significantly decreases the chance that the cancer comes back, that the cancer will come back. That could be part of the explanation, between an association of CAM use and a lower survival in cancer. I mean, it's not a definitive study. I wrote about the study on my blog, and I wrote about both studies on my blog. And, the numbers were a little small to put a huge amount of confidence in them, but the overall results do seem to ring true as far as, what we know.
Mm-hmm. Okay, so one of your main preoccupations, let's say, is with a CAM that targets specifically cancer patients, right?
Well, for me, sure, because I'm a cancer surgeon, so of course that it's my area of interest. Other doctors might have other concerns, but cancer is what I know. So
yeah, sure, it's perfectly understandable. Okay, so have you ever changed your mind about a specific pseudo-scientific therapy or medicine? That is what I mean by this is that did it ever happen to you that you started off thinking that a particular complementary or alternative medicine was nothing but quackery, and then you moved to a position where you thought that, perhaps it could be valid in certain specific cases, or vice versa?
Vice versa, yes. About 10 or 15 years ago, I thought there might be something to acupuncture. Because not because of all the nonsense about the chi and the unblocking of the chi and the meridians. That was all nonsense because I knew meridians didn't exist. I knew chi doesn't really exist. But you're sticking needles in someone, so maybe it does something. Then over the years, I read more studies. I delved into the acupuncture literature rather extensively, and became less and less impressed by what I found, and more convinced that acupuncture is basically, theatrical placebo. It doesn't really have any specific effects for anything. And I should have realized that earlier because what does acupuncture claim to be good for? Pretty much everything, like pain, infertility, constipation, heart issues, I could go on and on. Anytime a treatment is said to work for almost everything, it probably means that it doesn't work for that it works for nothing, that it doesn't work for anything. It's a good rule of thumb that I've come up. I suppose there might be an exception found one day, but I haven't found it yet.
Okay, that's fair enough. So, do you think that in science-based medicine, or even in other websites or publications, that you have already covered all pseudo-scientific therapies that exist, or are they all the time popping up, or are new ones all the time popping up?
Well, yes and no. I mean, broad categories, Yes, I think we've covered pretty much all the broad categories at one time or another. But new things keep pop. I shouldn't say new things. I should say variations on a theme keep popping up. For instance, and every so often I hear of something that's like out there and I haven't heard of before that actually doesn't fit. It's a lot less frequent than it used to be, but it does occasionally happen. I don't know. Are you familiar with the Quackwatch website?
No, I don't think so.
I mean, Steve, before us, there was Quackwatch, and it's still around. Steve Barrett, put it together years ago, and you looking at it's pretty comprehensive. It covers like almost everything, but because it's kind of out of date. Because it hasn't been updated that frequently in a while. But you could see going back the same sorts of things. I like to look at it this way: the American Cancer Society, in its journal and through its journal, used to keep a list of unproven and unrecommended cancer therapies from like the 60s until the early 90s. I don't know why they gave it up. The early 90s kind of coincides with the rise of CAM, but if you look through those articles, and I went through like over the course of like several weeks, and I downloaded pretty much every PDF of all the articles going back to the 60s that I could get access to. And you find some stuff that you don't hear about much anymore, but if you actually read about it, it's just you realize it's still around, just under a different name. And then of course some things never change, like the Gerson therapy, if you're familiar with that, for cancer, which it involves basically a rather harsh dietary manipulation, lots and lots of supplements, and 5 coffee enemas a day. So I've never been able to figure out the coffee enemas. I just never have been able to figure that one out.
Yeah. Okay, so perhaps the last thing that I would ask you today is what would you tell in terms of advice to your patients? What would you say would be the most effective and useful advice to give patients in order for them to try to avoid as much as possible to get into CAM?
I think a couple of things. The first thing is one that people understand but somehow don't apply to medicine all the time. And that's if it sounds too good to be true, it almost certainly is. People know this. They think this, in other things, like looking at the deal on a car or something like that. They have that innate skepticism that, like, if the deal sounds too good to be true, then it probably is. But somehow when it comes to medicine, that doesn't always kick in the way it should. The other thing is, the other thing is, like I said before, if whatever you're being sold or whatever they're trying to sell you is said to be able to cure all sorts of things or is to work for almost everything, then it probably works for nothing. And finally, just be skeptical, look for other sources of information. Don't take things at face value. I realize it can be hard with a lot of CAM because there's part of the problem with CAM or integrative medicine is that it slaps a patina of scientific plausibility on stuff that shouldn't have that at all. But just be skeptical, and that goes for conventional medicine too, but conventional medicine can usually answer the skepticism better than integrative medicine.
Right. And so just one last question. Do you think that perhaps one of the reasons why people get so easily into CAM is because many times it is much easier to follow the treatments that chem therapists propose than conventional medicine?
I don't know if that's necessarily the case. Some of these treatments are actually pretty hard to follow. The Gerson therapy, for instance, have come back to that, but granted, that's not CAM, but it's an alternative treatment. The Gerson therapy, for instance, requires you to drink like 13 glasses of freshly made, like vegetable juices during the course of the day, to down handfuls of supplements, and to do 5 coffee enemas a day. You know, you basically have time for nothing else, you know? It's like for 13 hours a day, you're like making juice and drinking it or doing coffee enemas, you know? So that's like actually pretty rough, you know? For instance, there was a therapy similar to Gerson therapy that was touted in like around the early 2000s and even reached the level of a clinical trial through NCAM and the National Cancer Institute, called the Gonzalez treatment. And it's similar but not identical to the Gerson therapy. It involves coffee enemas, et cetera, and it was for pancreatic cancer. Well, the early case series, they would present these best case series of these pancreatic cancer patients who survived way long, you know, considerably longer than you would expect based on having, you know, advanced cancer. Well, you know, it could very well have just been selection bias. The people who could actually do the regimen were in better shape. The patients who could do the treatment were probably in better shape than the patients who couldn't. And so patients who could keep doing the treatment could presumably have survived longer because of that. In any event, it's, you know, it's a complex issue. And as far as why do patients is it easier? Yeah, some of them are probably easier, but ask any primary care doctor what the hardest thing to get your patients to do is. Lose weight, right? Exercise more. Stop drinking, stop smoking, you know, the very basic things that we've known for decades that, you know, stop doing the things that we've known for decades are bad for you, you know, right? It's like, and start doing the things that are good for you, like exercising and, you know, eating more vegetables. It's the hardest thing to get patients to do. I mean, someone once suggested to me that maybe integrative medicine could be okay if it actually could prove that it was that these practitioners were better at getting patients to do these things than, you know, your regular family practice doctor, your regular internist, your regular primary care doctor. My retort is that they've never, as far as I can tell, have shown that they're better at doing even this. you know, getting patients to change their lifestyle to promote health, because, you know, people don't want to change. Well, it's not just you don't want to change, it's hard to change. We like food, we like our drink. People who smoke like their cigarettes, you know. It's like, it's hard to get them to change behavior. If you've ever tried to change behavior, you probably know this. I mean, I know this from trying to lose weight. I'm not like massively overweight or anything, but I certainly could use to lose a few pounds. So,
yeah, okay, very well, Dr. Gorski. Just before we finish this year, would you like perhaps to share with people, apart from what I have already referred to in the introduction, where they can find you online and follow you?
Oh, but of course. Well, science-based medicine is sciencebasedmedicine, one word, .org. You know, so sciencebasedmedicine.org. I'm on Twitter at Gorskon, Gorskon. My personal blog is respectfulinsolence.com. Again, you know, one word. Science-based medicine is also on Twitter at science-based-med, because that's as long as they let you make your handle.
Yeah, right.
Then, you know, that's about it. Steve Novella's blog is a Neurologica blog. Just Google it because it's not like, it's the Nest / I think neurological blog. So,
Okay, Dr. Gorski. So I think it was a very fun interview that we had here today,
Yeah,
and I would like to thank you again for taking the time.
Thanks for inviting me.
Hi everybody, thank you for watching this interview until the end. I would also like to ask you to please pay a visit to my Patreon page and consider making a pledge if you like the work that I've been doing. And I would also like to give a huge thank you to my patrons, Karen Litzke, Anne Blanchett, Per Elga Larsen, Lau Guerrero and Chantel Gelinas. Thank you for all.